Hi guys, in what sounds a little bit like the electronic border to resolve the problem in Northern Ireland created by Brexit, Rishi Sunak is suggesting that technology in the home will save the NHS after years of underfunding by his party and a mass exodus of staff over issues of pay and conditions. Hospitals at home is his solution to the problems facing the health service. Yes, you heard that right. You don't go to the NHS, it comes to you. Well, that seems to be the plan, but I have one major issue with it. First, let's hear what Rishi had to say.
So, what does it mean, right? This is, as you said, that we can basically set up hospitals at home for people, right? And we can do it in areas like COPD, respiratory conditions. We can do it in areas like frailty. And the technology allows us to do that together with new ways of working that, that Kath has helped develop here. And it does exactly what you've said. It means that we can stop people coming into hospital in the first place. It means we can, and it means we can get them home quicker. And actually, we were going over some of the stats this morning at North Tees, how we're able to do it. I think it was in COPD we were discussing, right? 30% reduction in admissions for people coming in because of this type of service for COPD, and a reduction in an average stay from 5 to 3 days. I mean, this is huge, right? You replicate that across the entire NHS. If we can roll that out properly, it'll make a big difference. So that's part of the plan today. So when you go home and have a flick through this plan, it will say that we've got currently about 7,000 virtual ward beds, and that's going to grow to at least 10,000 over the course of the next year. And on top of that, we want to make sure that the utilisation of those beds goes up from where it is currently, which is lower than it should be. And we're going to support all those hospitals who don't quite know how to do it properly, because what you're doing is pioneering, right? And what we need to do is support every other hospital to introduce virtual wards and think that way, because it's a new way of thinking, and it requires, as Kath was saying, it requires a bit of out-the-box thinking sometimes. But if we can get everyone to do that, it's going to be amazing. And that's a big part of our plan today.
Is it only me, or does he sound like a marketing manager or the CEO of a company? Okay, anyway. Look, I'm not an expert on this, so I don't know if this question I have is valid, if it's applicable to this service. But there is an issue of staff. Who's going to staff this? So let's imagine this is the scenario that he's presenting. Instead of coming into the hospital will come to you. So they will send equipment to your home to monitor you. Maybe somebody who's lying in bed all day, they can't get out of bed, they have breathing problems. So there will be a system put in place to monitor this individual, this patient. This is a good idea. So that if there's a problem, it alerts the hospital and the hospital sends an ambulance. But there's also the problem of the ambulance. How long will it take for the ambulance to arrive? It doesn't resolve that problem. There will still be a call out. But nurses are already at breaking point. What you're going to have, it seems, is you'll have nurses who will be doing their normal duties in the hospital, but also doing duties of monitoring people who are at home as well. Is there extra staff going to be made available for this? Probably not. The nurses are going to have to spend time getting trained up on how to use these services, to use this technology. And what if there's an intervention required immediately? How do you send a doctor there? How do you send a nurse there? Do they have to leave their position in the hospital and go by car or by public transport to deal with the problem the patient is suffering if they can't get an ambulance there on time? There are a number of questions, but the main question is, how is it going to be staffed? The NHS is already struggling with staff, 150,000 vacancies at the moment. And you're introducing technology that will require either new staff or existing staff to be trained up. And there's no mention of where these extra workers are going to come from. Is it going to be another workload put on staff, nurses in particular, who are already overworked, who are already saying we're at breaking point? Technology is a great solution in many cases, but you always need people there. And I don't think Rishi Sunak has fully understood the impact this is going to have. Or maybe he just doesn't care. Either way, I don't see this working out. But once again, I'm not an expert. If anyone knows much better about this, do let me know in the comments. As always, let me know in the comment section, guys, what you think. As always, the comments are greatly appreciated. Thanks a lot.